Question number 4, Mr Speaker.
Minister.
Thank you, Mr Speaker. Improving our understanding of women's experience of health and the health service is a key priority for this government, and that's why in March of this year we launched a call for evidence asking women to tell us about their experience, and we had nearly 100,000 responses which we are working through now, which will form the baseline of England's first ever women's health strategy.
Richard Holden.
Thank you very much, Mr Speaker. I thank the Minister for her answer. Yesterday, this House passed a UK-wide ban on virginity testing in the Health and Care Bill. But banning virginity testing will only work if hymenoplasty is banned alongside it. Will the Minister use her good offices to ensure that the Government introduces amendments to ban hymenoplasty in another place and then encourage other countries around the world to stop these practices worldwide?
Minister.
I thank my honourable friend, and I'm sure all members across this House will welcome the Government's amendment yesterday to ban virginity testing. In terms of hymenoplasty, the evidence for a ban is mixed, and so the Government has convened an independent expert panel to review all the evidence and look carefully at the issues, and that will report back to ministers before Christmas.
Alex Davis.
Thank you, Mr Speaker. It's HIV Testing Week in Wales, and yesterday I joined with the Terence Higgins Trust and Fast Track Cardiff and Vale to do my own free home testing kit. In Wales, everybody can get access to a free HIV test at home through Frisky Wales, but in some areas of England, free home testing isn't available to everyone. So will the Minister work with her Cabinet colleagues to follow where Wales leads and ensure that everyone in England can get access to a free HIV test kit if they wish to?
Minister.
I thank the Honourable Lady for her question. She raises a very important issue. Free testing is available across the NHS in England, and same-day test results are often possible. In terms of home testing kits, I will look at that specific issue she raises, because it's important that everyone who needs a test has access to it.
Chair of the Committee, Caroline Milks.
Thank you, Mr Speaker. One of the times that women most engage with healthcare services is when they are pregnant. My constituent Michelle, a qualified midwife, has contacted me talking specifically about the importance of retention in midwifery and highlighting the crisis that she says there is. Please, my honourable friend, highlight what she is doing to make sure that qualified, experienced midwives stay working at the front line where we need them.
Minister.
I thank my honourable friend for raising this important issue, and maternity care is a key top priority for the Government. Earlier this year, the NHS England announced a £95 million recurrent funding package to support the recruitment of 1,200 midwives and 100 consultant obstetricians. Maintaining both the skill mix and the numbers is key to retaining experienced midwives who often have to take the pressure when there are staff shortages.
Robert Barclay.
Thank you, Mr Speaker. I welcome the Government's commitment to tackling disparity in our healthcare, which is particularly important when it comes to maternity care. So can I ask the Minister to speak to her colleagues at the Department for Health and Social Care when it comes to Tameside Hospital, where there is a desperate need for capital funding in a new maternity unit and antenatal clinic. The current unit is located at Charlesworth House, first built in 1971. It's poorly insulated, sensitive clinical equipment often overheats, and capital funding bid badly needs support. I hope she can work with me on this to deliver better healthcare for the women of the High Peak.
Minister.
Thank you, Mr Speaker. Maternity care is a top priority for this Government, and we are making progress. Since 2010, we've seen a 25% reduction in stillbirths and a 29% reduction in neonatal mortality. In terms of a new maternity unit at Tameside, I understand the Acorn Birth Centre opened last year and has been well received locally, but I'm happy to discuss further improvements with my honourable friend.